Hello friends, welcome to Sri Medi Park. In this video, we are going to see the clinical anatomy of clavicle. Yes, so நம்ம already clavicleனா என்னன்னு பார்த்தோம். So clavicleன்றது ஒரு long bone and it is also called as a collarbone or beauty bone. So clavicle bone, it is divisible into lateral end and medial end. So in the clavicle bone, this clavicle bone, so இதுதான் clavicle bone. This clavicle bone extends between the manubrium of the sternum and the acromion of the scapula. So இதுதான் வந்து acromion of the scapula. So இது clavicle bone. So this clavicle bone extends between the manubrium of the sternum and the acromion of the scapula. So this clavicle bone is the only long bone that lies horizontally. Then இந்த clavicle bone தான் shoulder region support பண்ணுது so that this clavicle region supports the shoulder region so that our arm can swing clearly away from the trunk. ஒரு clavicle bone தான் நம்மளோட shoulder region support பண்ணுது ஸோ அதனால தான் நம்மளோட shoulder region மூவ் பண்ண முடியுது நம்ம பாடியில இருந்து. So in the picture you can see that the clavicle bone has a curved part that is called as the shaft. Okay, so shaft irukku. So this is the curved part called the shaft. In its two ends, that is the lateral and the medial end. So lateral end என்றது it is away from the medial plane and medial end என்றது towards the median plane. So median plane என்றது a median plane is a plane that divides the body into equal right and left half. It is called as the median plane. So lateral end அப்படின்றது it is away from the body and the medial end அப்படின்றது it is towards the median plane, right? So this is a shaft. In the lateral end வந்து it is flat இருக்கு. This lateral end is flat and the medial end it is, here the lateral end is flat. You can see in this picture it is flat and this is the curved part. Here this medial end it is large and quadrilateral in shape. Next is the clinical correlation. First one, clavicle fracture or commonly called as collarbone fracture. So clavicle or collarbone fracture. So clavicle is the one of the most frequently fractured bone. So நம்ம clavicle தான் வந்து it is the one of the most வந்து frequently fractured ஆகிற bone. That is clavicle. Okay, functions of clavicle 3 points இருக்கு. First one வந்து this clavicle transmit the forces from the upper limb to the axial skeleton. So upper limb ஓட force axial skeleton க்கு transmit பண்ணும். And the second one வந்து the clavicle bone supports the shoulder region so that our arm can swing clearly away from the trunk. So this is supported principally by the trapezius muscle. So principally it is supported by the trapezius muscle. And third one is it provides attachment for muscles. So weakest point of the clavicle எதுனா it is the junction between the two curvatures. It is a junction between the two curvatures. அதாவது the junction between the medial two-third and the lateral one-third. Okay, medial two-third and the lateral one-third. So this junction, it is the weakest point of the clavicle and it is the most vulnerable part of the fracture. இது வந்து right clavicle. ஸோ இது lateral end and இது medial end. ஸோ இந்த ரெண்டு curvatureஸோட middle part தான் இது. ஸோ here 15% of fracture occurs in the lateral end. So 15% of the fracture occurs in the lateral end and 5 to 6% occurs in the medial end. And 80% of the fracture occurs in this middle third part. So இது superior aspect, இது superior aspect, இது frontal, that is the inferior aspect, and this is the cross section. The right clavicle, which is the weakest point of the clavicle, it is the junction between the two curvature, is the weakest point of the clavicle and it is the most vulnerable part to fracture. So in this cross section, in the cross section lateral part it is flat like this in shape, and here it is the weakest point, the middle third, and this is the medial end. It is large and it is large and quadrilateral in shape in the medial end. So lateral end flat so medial end weakest point. So இங்க பார்த்தோம்னா இது medial end, இது lateral end, and the junction between these two curvature is the weakest point of the clavicle. And next, what are the causes of clavicle fracture? Okay, so what are the causes of clavicle fracture? So the most common mechanism of injury is the fall onto the shoulder. It is fall onto the shoulder or onto an outstretched hand. அதாவது the transmission of forces to the axial skeleton in falls on the shoulder or hand may prove greater than the strength of the bone at this site, and this indirect force is the usual cause of fracture. The mechanism of injury, it may be fall with arm out onto the hand or fall onto the shoulder. So shoulder namak adipattuchinalum, or there may be a direct blow to the shoulder. So நம்ம handல அடிபட்டாலும், that is the arm out, handல அடிபட்டுச்சுனாலும் இல்ல shoulderல அடிபட்டாலும், and maybe a direct நம்ம shoulderல அடிபட்டாலும். So these are the three images, it would be clear. So this is the mechanism of injury. So this is the potential site. These are the potential site for the clavicular fracture. So this is the lateral end, this is the medial end, and this is the three part. இது acromioclavicular joint, and this one is the sternoclavicular joint. Okay, so first clavicular fractures especially it is common in children. Okay, so the clavicular fractures are especially common in children and are often it is caused by an indirect force transmitted from an outstretched hand through the, it is from the outstretched hand through the bones of the forearm and arm to the shoulder during a fall. And the fracture of the clavicle, it is also common in the adult athletes like football players, hockey players. So இவங்களுக்குமே fracture of clavicle it is common in the adult athletes. Okay, next is the clinical feature of the clavicle fracture. Okay, so when the fracture occurs, okay, here when the fracture occurs, the trapezius muscle is unable to support the weight of the arm, so that The characteristic picture of the patient with a fractured clavicle is that of a man supporting his sagging upper limb with his opposite hand. So இங்க this is the main clinical feature. என்னன்னா first a person, அதாவது the personக்கு வந்து fracture ஆயிருந்துச்சுன்னா, இந்த clavicle bone வந்து fracture ஆயிருந்துச்சுன்னா, so this is the image showing that it is a fractured clavicle. Okay, this is a fractured clavicle. So ஒரு fracture ஆச்சுன்னா the trapezius muscle, okay, இந்த trapezius muscle-ஆல நம்மளோட weight of the arm, so நம்மளோட arm weight வந்து support பண்ண முடியாது. It is unable to support the weight of this arm. So நம்மளோட weight of the arm வந்து it is unable to support. So அந்த பேஷண்ட் அவங்களோட clavicle fractured ஆயிருந்துச்சுன்னா அவங்களோட sagging upper limb, okay, sagging upper limb அப்படின்னா hanging down too much, that is அவங்களோட upper limb கீழே அவங்களால பிடிக்க முடியாம கீழே இருக்கு. Okay, it is sagging upper limb means it is like hanging down too much. The upper limb is hanging down too much. So அந்த weight அவங்க opposite hand மூலியமா support பண்றாங்க. So he or she is using his other hand, his opposite hand, to support this sagging upper limb. Next, the clavicle is directly beneath the skin and it is not covered with a muscle. A fracture can easily be palpated and frequently seen. So, see this picture. So, இந்த clavicle வந்து ஈஸியா skinல இருக்கிறது தெரியும். That is, the clavicle is present beneath the skin. It is directly present beneath the skin. We can feel it. When if we touch it, we can feel. So நமக்கு தொட்டா அதை நம்ம feel பண்ண முடியும். So in the bone, it is not covered with any muscle. And so fracture ஆயிருந்துச்சுன்னா நமக்கு ஈஸியா தெரியும். அதாவது இது மாதிரி வீங்கிருக்கு. That is palpated and it is seen. Okay. And here, this is the clinical anatomy. So clinical anatomy, so the clavicle is commonly fractured by falling on the outstretched hand. That is the indirect violence. So the most common site of the fracture. Okay, so most common site of the fracture, it is the junction between the two curvatures of the bone. So these are two curvatures of the bone. So this lateral end, அப்புறம் இது medial end. So this is the two curvatures of the bone junction. இது வந்து the junction between the two curvatures of the bone. Okay, so this in the junction நம்ம weakest point நம்ம சொல்றோம். Okay, so in the junction நம்ம weakest point நம்ம சொல்றோம். So the lateral fragment னு சொல்லலாம், and this one is the medial fragment நம்ம சொல்லலாம். So in the clinical anatomy, we have to know about 3 points. So the 3 important points நமக்கு clear-ஆ தெரிஞ்சிச்சுனா, so clinical anatomy of clavicle is clear. Okay, so first important point வந்து என்னன்னா, the lateral fragment is displaced downwards by the weight of the limb as the trapezius muscle is unable to support the weight of the upper limb. That is, so இதுதான் lateral fragment. So in the lateral fragment, it is displaced downwards. It is displaced downwards or displaced inferiorly னு சொல்லலாம். Okay, it is displaced inferiorly னு சொல்லலாம் by the weight of the limb. So it is displaced downwards by the weight of the limb, this lateral fragment. And next, here it is displaced medially by the pectoralis major. So இதுதான் வந்து pectoralis major. It is displaced medially by the pectoralis major. And next, the another fragment, that is the medial fragment. So இது வந்து medial fragment. So in the medial fragment, it is pulled upwards. அதாவது it is displaced. Okay, it is displaced superiorly. Okay, so இது நம்ம inferiorly சொன்னா இது superiorly சொல்றோம். So it is displaced superiorly by the, it is pulled upwards, that is superiorly by the sternocleidomastoid muscle. So S superiorly க்கு, so S superiorly க்கு sternocleidomastoid. So இப்படி நான் வச்சுக்கலாம். So the first one is the lateral fragment. It is displaced downwards, that is inferiorly by the weight of the limb, because trapezius muscle is unable to support the weight of the upper limb. So next one, this medial fragment, it is displaced upwards, that is superiorly by the sternocleidomastoid muscle. And next, medially by the pectoralis major. Okay, so this is the anatomical basis. So fractured lateral fragment. So fractured lateral fragment na, it is this one. So this is the lateral fragment. This is the lateral fragment, and this one is the medial fragment. So in the lateral fragment, it is displaced downwards. This medial fragment, it is displaced upwards. It is superiorly, it is displaced. It is inferiorly displaced downwards, upwards. This is displaced. There is a slight elevation. This one in the part, you can say it as a slight elevation by the sternocleidomastoid, and here it is inferiorly displaced down. And again, medially in a, here is a muscle spasm. So gravity, it is downwards, it pulls downwards. This upper limb வந்து நம்மளோட trapezius muscle ஆல, so நம்ம trapezius muscle ஆல upper limb ஓட weight it cannot bear. So that's why it is unable to support this weight of the upper limb. So it is pulled downwards. This lateral fragment is pulled downwards. So the fractured lateral fragment and the medial fragment by the sternocleidomastoid muscle. Here, this is the sternocleidomastoid muscle. So this is the sternocleidomastoid muscle, and this one is the trapezius muscle. So in the trapezius muscle ஆல நம்மளோட upper limb, so பாத்தீங்கன்னா இங்கே தெரியும், இந்த trapezius muscle ஆல நம்மளோட upper limb ஓட weight வந்து bear பண்ண முடியாது. It is unable to support this total upper limb weight, this trapezius muscle. So here this is the fracture of the clavicle. So it is a junction between the two ends, two curvatures. Like this is the lateral end, this one is the medial end. Okay, so medial end is towards the body. So in the side, in the axial side இருக்குது medial. So lateral is away from the median plane, right? So lateral end வந்து it is pulled downwards. Okay, pulled downwards, that is the inferiorly, and here it is pulled upwards by the sternocleidomastoid muscle. And next important one என்னன்னா coracoclavicular ligament. So coracoclavicular ligament என்னன்னா, the strong coracoclavicular ligament usually prevents the dislocation of the acromioclavicular joint. So is the acromioclavicular joint. So நம்மளோட acromioclavicular joint dislocate, அதாவது அதோட இடத்துல இருந்து வேற இடத்துக்கு மாறாம இருக்க, this strong coracoclavicular ligament, it prevents the dislocation of the acromioclavicular joint. So acromion process, the clavicle bone attach ஆகிற joint தான் வந்து acromioclavicular joint. Okay, so this is the brachial plexus, and this is the pectoralis major. So pectoralis major எப்படின்னா it is displaced by medially. So medially na this direction, medially it is displaced by medially. So here humerus, this is humerus, scapula, and the lateral fragment. So இது இந்த lateral fragment too, it is shift down owing to the gravity. So gravity கீழே கீழே தான் புல் டவுன் பண்ணும். ஸோ அதுதான் ஹியூமரஸ், scapula, and the lateral fragment of the clavicle will shift downwards. It will shift downwards owing to the gravity. So equal to gravity. So நம்மளோட proximal humerus, okay, this is the proximal humerus. It is pulled medially. Okay, it is pulled medially na எப்படி? By the pectoralis major. This is the pectoralis major, which causes the overriding of the fractured end, of the clavicle. Right. Here, so the lateral end of the clavicle may be pulled medially by the adductor muscles of the arm, such as the pectoralis major. Okay. So next important one is the supraclavicular nerves. So in the supraclavicular nerves, it lies in close proximity to the clavicle. So it's the clavicle bone. It lies, okay, so this supraclavicular nerves, it lies in close proximity to the clavicle bone and are occasionally sacrificed. This is the supraclavicular nerve. It is occasionally sacrificed during a surgical pair that results in the numb patch over the upper chest and shoulder. So இந்த supraclavicular nerve வந்து ஸோ இந்த clavicle மூலியமாக தான் போகுது. ஸோ அதாவது இது க்ளோஸ், இட் இஸ் இன் க்ளோஸ் ப்ராக்சிமிட்டி, கிட்ட இருக்கு clavicle போனோட. ஸோ சர்ஜிக்கல் ரிப்பேர், அதாவது இப்போ போன் வந்து ஃப்ராக்சர்ட் ஆயிருந்துச்சுன்னா, இப்போ சப்போஸ் இந்த போன் வந்து இங்கே ஃப்ராக்சர்ட் ஆயிருந்துச்சுன்னா, ஸோ இந்த சுப்ராக்ளாவிகுலர் நர்வ், ஸோ இந்த சுப்ராக்ளாவிகுலர் நர்வை கட் பண்ணுற மாதிரி இருக்கும். ஸோ இந்த நர்வை கட் பண்ணோம்னா என்ன நமக்கு சைடு எஃபெக்ட் கிடைக்கும்னா, இட் இஸ் அ நம்ப் பேட்ச் ஓவர் தி அப்பர் செஸ்ட் அண்ட் ஷோல்டர். நம்ப் பேட்ச்ன்றது மரத்து போகிற மாதிரி. ஓகே, ஸோ ரிசல்ட்டிங் இன் தி நம்ப் பேட்ச் ஓவர் தி upper chest and the shoulder region la namakku indha idukku varum. Okay, and this is the clavicle fracture in the x-ray. So idu medial end, idu lateral end. So idu lateral fragment, idu medial fragment. This is the junction between the two curvatures of the bone. So this is a clavicle fracture in the x-ray. So x-ray la இப்படி தான் தெரியும் clavicle வந்து fracture ஆயிருந்துச்சுன்னா. Next one is the cleidocranial diastasis. So this disease is the clavicles may be congenitally absent. Okay, so congenitally it is absent or it is imperfectly developed in a disease called the cleidocranial diastasis. So in these conditions, the shoulders will droop and it can be approximated anteriorly in front of the chest. Okay, so this is the example of the cleidocranial diastasis. So in the first condition, the clavicle is absent. Here in this first condition, the clavicle is absent. So clavicle வந்து இங்க இல்ல. So the clavicle is absent. That is what it is congenitally absent. Congenitally absent na by birth. Okay, so by birth அவங்க பிறக்கிறப்பயே உங்களுக்கு வந்து அந்த clavicle bone வந்து absent ஆயிருக்கும். And here in this you can see the shoulders are approximated. So in the picture the shoulders are approximated. approximated. Approximatedனா imperfectly developed ஆயிருக்கு. So in this condition it is imperfectly developed. So these are the two conditions. ஒன்று இந்த clavicle இல்லை, இன்னொரு இதில் it is approximated, அதாவது imperfectly developed. Next one, in this condition shoulders droop ஆகும் and it is approximated anteriorly in front of the chest, அதாவது so shoulders drooped. So here we have to know one thing, DSS. So DSS அப்படின்னா it is the droopy shoulder syndrome. DSS. So DSS அப்படின்னா a droopy shoulder syndrome. What is that? So it is a depression of the shoulder that stretches the brachial plexus, it causing the pain without any sign of the neurological impairment. So droopy shoulder syndrome, so very important. So droopy shoulder syndrome ஸோ ஒரு ஷோல்டரில் இருக்க ஒரு டிப்ரெஷன்னால, ஓகே, ஸோ ஷோல்டரில் இருக்க ஒரு டிப்ரெஷன்னால நம்மளோட brachial plexus மசில் வந்து ஸ்ட்ரெச் ஆகுது. while it stretches it causes the pain. ஸோ அந்த brachial plexus மசில் வந்து ஸ்ட்ரெச் ஆகுறப்ப நமக்கு பெயின் ஆகும். ஸோ அந்த பர்சனுக்கு பெயின் வரும். ஸோ வித்தவுட் எனி சைன்ஸ் ஆஃப் நியூரோலஜிக்கல் இம்பேர்மெண்ட், அதாவது எந்த ஒரு அறிகுறி இல்லாமல், லைக் ஒரு நியூரோலஜிக்கல் இம்பேர்மெண்ட் எந்த ஒரு சைனும் இல்லாமல் நமக்கு அந்த பெயின் வந்து வரும். ஸோ இட் காசஸ் அ பெயின். ஸோ தட் இஸ் நோன் அஸ் த droopy shoulder syndrome. Right? Thank you.